I want to give you a real live example of how outrageous the radical left is. I want to give you a real live example, just another one, example number 453,000, of their hypocrisy, their deceit, how they lie. I live about 40 miles from Washington, D.C., because I don't want to be in Washington, D.C., but I like my Commonwealth, my state of Virginia. So I'm able to keep an eye on the news there, and I watch some of the local races, whether it's school board or supervisors or the local congressional races and so forth. And there is a congressional race that involves the district I live in. And the guy who's running, the Democrat, another left-wing Democrat, it goes by the name of John Faust. He's on the Fairfax County Board of Supervisors. Fairfax County, for the rest of the nation, is really the most populous county in the state of Virginia. It's in Northern Virginia. Used to be a relatively Republican county. Now it is a Democrat county, for the most part. And this guy, Faust, wants to replace a Republican, Frank Wolf, in this congressional seat. So he tries to portray himself as a moderate, tries to portray himself as somebody who wants to do good, but he's just another lying leftist. He's running against a delegate, a Virginia delegate by the name of Barbara Comstock, who I've supported in the past and I've known for decades. But I want you to hear this story because this is so typical from the Washington Free Beacon. The OBGYN practice of Marilyn Jerome, the wife of Democratic congressional candidate John Faust, does not accept Medicaid, the Washington Free Beacon has learned. Faust, the Democrat, has repeatedly attacked his Republican opponent, Barbara Comstock, for opposing the Medicaid expansion under the Affordable Care Act in his campaign to represent Virginia's 10th congressional district. Dr. Marilyn Jerome, this is the wife of the Democrat, practices obstetrics and gynecology at Foxhall OBGYN Associates in Spring Valley, an upper northwest suburb of Washington, D.C. Jerome has practiced there since 1982. Foxhall is also where Attorney General Eric Holder's wife, Dr. Sharon Malone, practices. I notice all these women keep their own names. That's fine. Just saying. No physician or staff at Foxhall is listed as a Medicaid provider on the D.C. Department of Healthcare Finances database. A phone call to the office confirmed the practice does not accept Medicaid. So here we have the Democrat radical leftists on the Fairfax Board of Supervisors running as a moderate Democrat for Congress, attacking his Republican opponent for opposing the Obamacare expansion of Medicaid when his wife and her practice and the Attorney General's wife and her practice will not accept Medicaid, even if Medicaid was expanded. Why? Well, because they don't like the low reimbursements, ladies and gentlemen. They want to be paid the full amount for their services. They're good liberals. They vote one way and they act another way. But the hypocrisy of this Democrat, John Faust, is hard to imagine. John Faust, a Fairfax County supervisor, has made Medicaid a signature issue of his campaign against Comstock. One of his ads, Barbara Comstock would stop Virginians from receiving our own tax dollars back from Washington for the sake of her right-wing agenda. And having balanced 7 budgets in Fairfax, I can tell you that just doesn't make any fiscal sense. That's what he said last month. But Comstock's decision to once again go along with extremists in Richmond has real consequences for us, increasing health care costs for everyone, costing our state more money, and jeopardizing support for important priorities that we care about, like education. So the usual left-wing liberal claptrap. So I assume John Faust is about to smear his own wife, Dr. Marilyn Jerome, who refuses to take Medicaid patients. Faust has said Obamacare is clearly a good thing and that not expanding Medicaid to rural hospitals could be devastating. He's also enlisted his wife, the very wife who won't take Medicaid, to campaign on his behalf, with Jerome using her status as an OBGYN to lead Women for Faust. Well, he needs to change that. My wife supports me, but will not take Medicaid. That should be the headline. Jerome says on her husband's campaign website, as an OBGYN, it's essential to me that any politician I vote for know that a politician's place is not between a woman and her doctor. Lucky for me, I married a good one. I married a man who would never try to interfere with that relationship and make a woman's choice for her. How much crap do we Americans have to take? And she also authored a post for her Foxhall practice in support of the Affordable Care Act and expanding Medicaid, noting the government program helps low-income women, even though she won't, even though Medicaid's not accepted in her office. Most doctors and patients do not understand the implications of the Affordable Care Act, she wrote in March. The American College of OB/GYN provided some information that's very useful. There are 18.6 million women who do not have health care insurance now and are eligible for this coverage, and another 4.6 million low-income women who could benefit from Medicaid expansion. So let me repeat, just to point out to the entire country how this works. And this goes on a number of issues with all kinds of political hacks. Here you have a guy running as the Democrat for Congress in Northern Virginia, claiming that he stands for women. And his opponent, who happens to be a woman, doesn't stand for women. She's an extremist who opposes bankrupting her state because that's what the expansion of Medicaid will do. Right, John Kasich? Right, Chris Christie? Among others? Because it will. 25 to 30% of every state's budget right now is Medicaid. This massively expands Medicaid to apply to many, many more people, including those who are not poor. It can apply to a family that earns $80,000, $90,000 with 4 members. It's a leg in, a foot in the door to single payer. This massive expansion of Medicaid. So here you have this liberal radical Democrat on the Fairfax Board of Supervisors, a county of about 1.1, 1.2 million people outside of Washington, running for Congress, and his major issue is that his opponent, a woman, is against women, has joined the war on women, and she opposes expanding Medicaid, uses his own wife in these commercials, and his own wife will not take Medicaid. And his wife is in practice with the Attorney General's wife, who will not take Medicaid. Pretty amazing, isn't it? It's really not. Because these people think they're better than everybody else. And these people use these hot-button issues because they think that their constituents are stupid, and in some cases they are. They won't know the facts, and in many cases they don't because they're busy. So if the jerk goes out there and says that a woman is part of the war on women because she won't support the expansion of Medicaid, which will break the state, even though he uses his wife to say the same damn thing, and his wife doesn't accept Medicaid under Obamacare or any other conditions to treat poor women, she's an OB/GYN, that, of course, he expects to be kept secret because he's a liberal hypocrite. And we'll keep an eye on more and more examples of this because you need to know.